Beth, hello and welcome to the show. Thank you for joining this discussion about digital health development and the situation with the market in the APAC region. You are based in Vietnam and have been there for a decade, if I'm not mistaken. So, can we maybe just start there? So, very briefly, how come you decided to start a digital health company in this area? What kind of attracted you in that sense?
Yeah, well, thanks for having me on your podcast, Tiasa. Getting started. So, I've been in Vietnam for 5 years at this point, but in Southeast Asia as a whole, a little over a decade. What brought me to the region is I had joined the Peace Corps. I was born in the US from Albuquerque, New Mexico. And after I finished college, I applied for the Peace Corps, and they pretty much randomly sent me to Cambodia. And then for 2 years, I worked in a small clinic in the countryside and I lived with a host family. I was the only foreigner living there. I learned how to speak Cambodian fluently because not a lot of other people spoke English, and I just thought it was the most interesting and cool place. And so it was just supposed to be 2 years in the Peace Corps, and then after I'd go back to the U.S. and kind of have a normal life. But I found that I liked Cambodia so much, and I liked working in development. I liked Southeast Asia and the potential to have an impact at this kind of very interesting period of time that the region is in. And so I just kind of stayed ever since. And so that is originally what brought me here.
You started a company called Docosan, which is a healthcare marketplace that helps doctors grow their practice and focus on providing quality care. So when people go to Docosan, they can search for the provider that they need. If we go on the beginning of the story, how did you detect the problem that you're solving? How do you see the healthcare system in Vietnam and in the region that you're in, especially compared to the US healthcare system?
Yeah. After living and working in Southeast Asia for, I guess it was about 7 or 8 years at that point before I started Docosan, I just saw patterns. I saw patterns that had a lot to do with kind of like fragmentation and just poor healthcare experience, no matter whether you were, say, like a rice farmer living in a rural area in Thailand, or even like a kind of like wealthy Vietnamese living in Ho Chi Minh City. Healthcare is difficult to access. There's not a lot of good information online, good, transparent, trustworthy information. People are still using word of mouth to determine where you can go and where you can trust. There's a lot of problems too in variations in quality of care. So there's in Vietnam, especially, there's some hospitals and clinics that are fantastic quality, and there are some that are not so great. And kind of the only way that people know how to tell the difference between the two is word of mouth. And yeah, having lived here, just seeing how tech savvy people are, like how many youth there are, how great the internet is here. I mean, you go out to the countryside, you have like amazing 4G. You come into the city, it's excellent. Everyone has got like a supercomputer in their pocket. Yet the health system works like something out of like the 1950s. It was something that didn't make any sense, and it seemed like it was only a matter of time before yeah, tech would be able to bring a big change to healthcare. And so I thought like I could do this. This is something that I spent my life and career kind of like working towards. I'm very passionate about it, and so why not do a company where our entire mission is to make it effortless for people to access care at the push of a button. And so that's where Docosan came from. And even the name Docosan is a mixture of English and Vietnamese and has to do with healthcare access. It's doc as in doctor, and then Khosan is the Vietnamese word for available. So it's like doctor available. So it's all about connecting patients to a doctor who's available at the press of a button.
Mhm. And what kind of general challenges do you see in healthcare provision in Vietnam? In the last few years, because of the pandemic, we saw shifts in the workforce because especially nurses, started leaving the profession to just do something else that has more normal working conditions. So globally, even before that, we saw the projections of the increasing workforce shortages, and that's potentially increasing the waiting times and just general access to health and healthcare, and that's a global problem. So, what's the situation in Vietnam, where, according to the KPMG report from 2020, Vietnam managed to improve its universal healthcare coverage to 90% of the population and targets to reach 95% by 2025. How do you like? Where's the biggest impact of that that you are observing?
Yeah, so I think during the pandemic, it really drove people online for care because there was no other option. And Docosan was started in early 2020. And so the company was kind of like born in the middle of the pandemic, and we've had to cope with, lockdowns and, shifts in the workforce, people coming, working from home, in changing the way that we do things. And yeah, it was like physically impossible at some points to really get to a hospital for kind of like basic primary care during the strict lockdowns. And so people had to go online. And we started out as a doctor booking platform where you could find and book doctors across specialties and then go offline and go and get your appointment. But once the first kind of COVID lockdown started, then we quickly released a telemedicine function where the doctors could start online consultations. And from there, we saw that certain specialties really started taking off. So, for example, we saw a lot more consultations around mental health and psychology of people who are coping with, different kind of issues, and actually, even still today, when there's no lockdown situations, things are totally normal in Vietnam now and doing great. But the trend in mental health has continued because people tried this new way of getting care. If you're kind of in the middle of a mental health crisis, for example, you don't have to find a licensed psychologist and then drive halfway across town to meet them and then kind of like get down. You want to talk to someone right away, and that's something really powerful about telemedicine. Um, and not only that, but even for just kind of like general conditions and things too, after you have a teleconsult, the doctors can write prescriptions that can be sent through the platform. And then we also work with pharmacies. And so they can send the medicines direct to the doorstep of the patients as well. And so it makes it easy for them to get the kind of care that they need at home. Then, kind of after the pandemic situation, we had a big uptake, and of course, mental health and COVID testing and stuff like that. But then we saw there was a big need for diagnostics. And we had seen some trends in the US and in other countries with companies like Everlywell and Let's Get Tested, where they brought diagnostics into the home of patients, where you'd have rapid diagnostics or self sampling tests kits that patients could collect at home and then get sent to a neighboring laboratory. And so we did the same thing right here in Vietnam, where people can, get tested for a wide range of conditions, ranging from hormone health to sexual health to general like blood testing. Get the results from a licensed laboratory, and then they can hop in an online consultation with a doctor and get the treatment sent to their doorstep. And so, if you compare that experience of getting care entirely online at home, guided by a real licensed doctor, to having to, okay, book an appointment, go wait in line, see the doctor, go to a separate pharmacy. In Vietnam, a lot of the times the clinics are small places, and they may not have diagnostics and kind of a laboratory attached. So sometimes we even have to go to a third, blood testing facility to go and get tested. And so it just really resolves the issue of healthcare delivery and fragmentation through a digital platform. And COVID was it was a scary time for everyone. No one knew what was going to happen. Everyone was like, "Oh, there's going to be a huge like global recession," and people are still saying that now. Things, kind of like constantly change. But the number one thing that it did for digital health is it drove people online and showed them that there is a new way of getting care.
Mhm. And how many partners do you work with, and how do those partnerships work? So, for example, one thing is to offer clinicians a platform where patients can find them and basically in the same space. And just correct me if I'm like interpreting this wrong. So, on the platform, they can basically connect with the patients. And then this at home testing part, is that something that's kind of a separate thing? Or the doctors that are on the platform can, through you, say to the patient, oh, we might want to do this test. You can, let's just order that. So is it two services, so patients would just come to you for testing or just come to you to visit the doctor, or are all these services connected?
They're all connected. So everything is built on top of our marketplace of third party providers. So we work with over 2,000 licensed medical providers across Vietnam. They work in all sorts of specialties, ranging from family practice to psychology to really specialized care like oncology. Um, and so they list themselves on the platform. They can accept appointments through there. And then there's software specifically for the doctors themselves that is called Docosan Pro, where they can do the teleconsultations, they can manage their practice, they can send prescriptions and medical notes to the patients. And then on top of that, we have the home diagnostics. And so, say you order an STD test kit. It's one of our best sellers is this STD test kit that tests for five different unique STDs. And so you order the STD test kit, you collect the sample, you get the results, it's sent to you on your phone, and then you have a positive test result. No need to panic. You just hop in an online consultation. It's included inside of the package with a licensed doctor from the network. And the doctor can then say, hey, I see, you have a positive test result for, say, chlamydia. It's okay. Here's a prescription. We can get you the right antibiotics, take them over this period of time, and then we can go from there. It's also like very discreet, nicer than having to have like an awkward conversation with a nurse or someone else. And the brilliant thing about the business model is that Docosan remains a third party. We're still the marketplace. We're still the software connector. We don't have to hire a single doctor or build a single clinic or compete with the medical providers themselves. We just help to connect them to patients in a new way that helps the patients to get care in a much better and convenient manner.
Mhm. So, what kind of data do you have about the consultations that happen or the medical records that are created? Are they created through the platform? So, basically, what's the liability that you carry as the third party provider, but still the enabler of care?
Yeah, so we do get a lot of interesting data. And for the company, we can work with de identified data. So we wouldn't go in and look at an individual patient's records. That is only between the doctor and the patient themselves. But what we can look at is, say, trends like what are people searching for, or what are common like specialties that they're booking for. And we can get a lot of insights from that. And so last year, there were periods of time where we'd see upticks in COVID. We could say, hey, I mean, there's another COVID outbreak that's coming because so many people are starting to book COVID tests. Or there was a period of time where a lot of people were searching for dengue and kind of childhood flus. And we're like, hey, something else is going on here. We can make sure that we've got a lot of pediatricians ready for like the online consults and referrals because a lot of people are searching and booking for those particular reasons.
Mhm. And does that mean that you also work with the government? Like, what are the restrictions or obligations that you have toward reporting the data that you are gathering? Everything that you said sounds really useful for public health officials, for example.
We would love to work even closer with the government than we have before. So all of the providers on our network are private providers. So we don't connect any public health facilities to patients themselves. But we have worked with the Vietnam HIV/AIDS Authority under the Ministry of Health here, and they're based in Hanoi because we do a lot of testing around STDs and in particular HIV. And HIV is well managed and well controlled by the Ministry of Health. They have whole networks of clinics that provide even like free care, free medicines. Just yeah, like 2 days ago, there was a patient who was inquiring about. He was kind of like panicking because he was talking to our medical concierge about needing an STD test because he was like freaked out. He didn't know what to do. had something happened to him like the day before, and so he was talking to the concierge, and she said, um, we have this whole like network of clinics, and she linked him to one of our clinics that could provide free post exposure prophylaxis for HIV PEP that was sent to his doorstep. And so this guy was able to get like all of his HIV like prevention medications for free, and then told him, okay, just like monitor the situation, and then if you want, there's all these different places you can get HIV testing from, and say like 6 weeks after the window period happened. And so yeah, we work with referrals in that kind of like HIV network, but kind of like beyond that, it's all focused around private healthcare.
Hmm. So none of this is covered basically from the universal health coverage that I mentioned before. This is all out of pocket payment.
It's not. It's the vast majority is out of pocket,
Hmm.
and yeah, kind of like where Vietnam is right now, a very small proportion of people have private health insurance, and so the vast majority of private health transactions that are happening are out of pocket. People are not covered, but it does create an interesting kind of like incentives in the private sector. So a lot of people are surprised to find that when you're using Docosan, you can search for prices of different types of consultations and services across providers. And the providers are willing to offer their price lists because they know that most of the patients, they're price sensitive because it's coming out of their own pockets. And so that is also something that kind of like drives prices down a little bit. You don't have insurers as the major payers kind of negotiating rates behind closed doors that drive prices up for people who are uninsured. But yeah, in terms of like private insurance proliferation, Vietnam has a way to go. But I think as far as uh, affordability in the private sector, there's a lot of different options for patients. So we have like quite a few clinics that offer consultations for less than $2, which is highly accessible to the region's middle class or even kind of like below that. And so our whole goal with Docosan is to give people choices, options, transparency. There's a lot of affordable private clinics if that's what you're looking for, and there's a lot of like high end clinics too. And we just want to let you know what your options are to get care.
And what is the relation between the private and public sector in healthcare in Vietnam? Can clinicians that work in the public sector also work in the private sector? I'm kind of wondering if you see that what you're doing is in any way disrupting the existing system. Is the public healthcare system trying to learn something about how to efficiently provide care to patients?
Yeah, so I guess like health spending in Vietnam is about half and half. So about half of the market is in covered by the public sector, and then the other half is the private sector. And the way that we kind of like see our role is we want to be very strong, especially in primary care specialties, like helping people get online consultations, at home diagnostics, all this kind of like preventive kind of medicine that they can get without having to wait in line at a large public hospital when they don't have a severe illness. Because when you start having lots of people waiting at these kind of specialty hospitals that are run by the state, you cause crowding. And crowding is a major issue in the public hospitals in Vietnam, especially in the big cities where you have some very fantastic doctors. People will wait in line for 4 hours plus to see a doctor for just 2 minutes. But in Vietnam, a lot of the times, those doctors who are working in the public sector also have their own private clinics. And a lot of the patients who are going to the public sector because they don't know where else to go could also afford to easily just go and see the doctor at a private clinic or hospital, pay a fee and, not clog up the public system. Which is an interesting kind of way of doing things because the doctors who have those private clinics, they're also business people. They have their own clinics. Like it's got their own names on it. Usually, it'd be like Dr. Ngaz, like neurology clinic, for example. They're very proud of it. They're all about building their reputation, and that is one of the primary reasons that the doctors join Docosan is they want to build their reputation, get seen by a wider audience of patients online, and discover people beyond word of mouth circles. And we help the clinicians to do that because if you look at doctors, they're super smart people. They have highly specialized training, but they don't want to spend a lot of time on administration, managing their calendars and bookings. They don't want to spend time on marketing, or let alone hiring a marketing agency. And this stuff it takes a lot of their time when they're running their own private clinic. And so we say join Docosan, and we'll help to offset some of that burden so you can focus on what you do best, which is seeing your patients.
Mhm. How do you approach growth of providers on the platform? The average clinician has well above 10 years of experience under their belt, if I'm not mistaken. And so I'm wondering, like, two things. What kind of vetting you do, and how can maybe younger clinicians get on the platform? Can they do that?
So younger clinicians can get on the platform if they are fully licensed by the Ministry of Health. So the first level of vetting that DocOSAN does is a compliance vetting. So we check the medical practice certificate of every doctor in the network, the operating license of every clinic, and then also a business license to make sure that it is fully like recognized under the Ministry of Health. Because in some countries like Vietnam, that's not even a given. So every once in a while, there are unlicensed clinics that pop up and unethical practices that really can be dangerous to patients. And we never want to be responsible for sending a patient to an unlicensed doctor. So that layer of compliance is really important to us. Then above that, we have other types of criteria that are not public, but you do notice that the doctors on our network tend to have a lot of experience. But we do work with younger doctors too, as long as they have their own kind of private clinic or working in a private hospital. And a lot of the times, the younger doctors provide fantastic care. We have younger doctors who have done fellowships at Harvard, at Tulane, at all sorts of like well-regarded international institutions, and then come back to Vietnam where they opened their practice. And I think these doctors are super interesting because they're so passionate about their patients. They're passionate about growing their clinics, and it's a bit of a new style of doing things, because in the past the way that you would get a big patient base was you would have to work for a long time to get that really wide word of mouth circle from people who had physically seen you before. But now that we have connecting platforms like DocuSign, you can really shortcut that time that it takes. Where if you're a really good clinician, patients are happy with the care that you get a lot of positive reviews, you'll appear higher in our search ranking, and then more people will see you. And so it becomes a bit of a flywheel that self supports it. You provide good care, more patients will see you, and both sides are happy.
Hmm. And how do you manage those reviews? You know, when healthcare is a little bit of a it can be a challenging profession in the sense that errors do happen, mistakes do happen, and they can be a little bit more critical than, for example, in some other industries. So when it comes to ranking and reviews, I'm always thinking, what if there's one bad review that then kind of causes a down spiral for you as a provider, even though, you know, mistakes happen. So, do you have any system of managing that? And yeah, how do you prevent that? Then people don't just try to use those that are on the top, even though that those that aren't visible yet or are just new on the platform don't even get a chance to get patients.
Yeah, that's a good question. And our algorithm is consistently improving as we learn more and experience more situations like this. But we do have a moderation system to make sure there's no sort of like, abuse that is going on in the reviews. And the company can step in if, there's ever some sort of like dispute around a particular review. But it happens surprisingly infrequently. Usually, when people patients aren't happy, it's because of wait time. Maybe the doctor was like overly busy on that particular day and they had a longer wait. But yeah, I guess like with reviews in healthcare, it is a little bit of a delicate manner because it's hard for patients to accurately assess the clinical capacity of a doctor. They can't, right? There's a big information asymmetry between the doctor and the patient. But what the patient can assess is like, okay, was the doctor respectful? Were they there and on time? Was the staff, was the clinic, clean looking and orderly? And so our goal in the reviews is to give the patients an idea of what to expect when they go to any particular clinic. And so you'll see that, yeah, of course, there's mixed reviews on most, but I think like we have a pretty high quality providers on the platform, and some of the best quality providers in Vietnam, period, on the providers, and the reviews of them do reflect that. But for newer doctors, we give them a lot of tips on how to get more positive reviews and use the system so they can kind of like front load it, say by adding their own patients to the system. Because it is a patient management platform. It's got a whole customer relationship management system in it. And so, yeah, there's all sorts of ways that we work with the doctors to help improve their visibility.
Currently, Vietnam is enjoying a so-called golden structure in its age demographic. So it's a younger population. 70% of the population is aged between 15 and 64 years. And I thought that was an important data point for you, as an internet provider. And I wonder, how do you see it as a factor that impacts your company and your success? Does it have an impact, or you know, what are your observations?
Yeah, I mean, it has a huge impact. So, our core demographic is millennials. It's not older people. A lot of the times, like when you think about healthcare, especially in the West, we think about people with like older, with chronic diseases, more complicated cases. But all sorts of people need healthcare. And an interesting thing about millennials in Vietnam is a lot of them have become the decision makers for their households. You have a lot of multi generational households, and in particular, like the women are the ones that are making the healthcare decisions for their families. They will make a pediatric appointment for their kid. They'll schedule, like a work health check for their husband. They'll schedule whatever type of care for elderly family members who are living with them. And so the main demographic is the millennials, but then they also book care on behalf of other generations. And I think that's a really strong point of the platform. We're even seeing more Gen Z who are starting to use the platform too when it comes to online consultations, mental health. We have certain packages that are around birth control, and it's surprising like how many questions people have just around taking, just basic birth control. There's not a lot of like good quality information out there, and sometimes when people go to the pharmacy or even offline to the clinic, the clinician might be a little bit too busy to finally totally explain something to someone, especially if they're really young. There's also a lot of stigma around it. But they get care online, and they look online, and they're Googling, and then when they're Googling, they'll find us. They'll see one of our blogs about birth control and the right ways to take it, or they can schedule an online consult with a doctor. But honestly, like a lot of the care is happening like just on chat, where people are starting to book it, or they're just ordering like the test kits, yeah, to their homes. And so that is an interesting kind of behavior that we're seeing because you do have such a young population here.
hmm And do you think that, I don't know, in the future, you could expand in your focus also to maybe some other things, such as offering the care to maybe less wealthy populations? Or how do you see the whole? So the debate around access to health and healthcare, which is very broad, you can go from discussing how do you provide care in rural or remote areas. You can go to how do you provide and make care accessible to the less wealthy populations. How do you see, the further development of the company? Is it going to near country markets?
Good question. And a lot of our growth strategy is now focusing on second tier cities, and of course expanding to other markets in the future will be something that's very interesting. In starting the Docosan platform, I didn't want it to be a solution just for, very wealthy, kind of like white collar workers. It wasn't something that kind of like motivated me to start something. I want Docosan to be something that changes healthcare for the better for everyone. I want it to be a new paradigm. And so if you think about how technology has changed other industries, like in Southeast Asia, we have Grab, which is like a Southeast Asian version of Uber. Everyone uses it. It's very affordable. You can take it, kind of like anywhere. And it's, yeah, if you're certainly like, middle class or above, it's a great option for you. And I want Docosan to be like that. I want it to be something that helps millions, or potentially in time billions of people get care in a new manner. And yeah, it's not just for the wealthy people. And it's one of the strengths of our business model in being a marketplace, that we can offer so many different options in prices to people. So like I was saying before, we do have certain clinics that charge less than $2 for a consultation, very accessible to most people. Of course, we have stuff on the high end as well. And we're constantly working to just give people more and more choices so they can find something that works for them in terms of convenience, in terms of quality, as well as in terms of price.
Did you already observe or do any research about the differences among the countries in the regions? You mentioned in the beginning that you actually first moved to Cambodia and now live in Vietnam. So I'm assuming that market is also quite familiar to you.
Yeah, I love Cambodia. So yeah, Cambodia is at a different stage of development than Vietnam, but I think it does have a lot of potential. There's a lot of people that could use a healthcare solution, a tech-enabled healthcare solution, especially in the private sector, to get the right kind of care. Same thing in Thailand. Thailand, I think, is another interesting country because they want to be a medical tourism hub of the world, because they have all of these fantastic high quality doctors. A lot of them are US board certified doctors that you have in Thailand, just an incredible kind of like health system there. And yeah, I think there's a lot of strengths and, pain points in each of the markets, and they're different. But it's not much more fragmented than in the US. A lot of the times people look at Southeast Asia and say like, oh, they're also different, kind of like languages and countries. Like there's no way you'll ever be able to, kind of go across everything. But if you look at the US, you have 50 different states. And so if you want to practice telemedicine in the US, you have to get 50 different like licenses to practice telemedicine. That's fragmentation too. And you have companies that are doing it all the time. And so I think as long as you properly follow local regulations, and that's always really important for healthcare, even more so than other industries, because it deals with human life and it is highly regulated. But you're really compliant, you follow the local laws, you localize to the extent that is needed. I think a lot of the pain points in healthcare are universal. Everyone would like to have better, more affordable, high quality healthcare, no matter what country you're living in. And actually, I just got back from Switzerland. I was there for a conference, and I was there for 1 week. I went there with my husband, and he's got asthma pretty bad, but usually it's under control because he's got an inhaler. And but he forgot his inhaler in his bag, and so we fly to Switzerland. He gets there, it's freaking cold. It's like really high altitude, and we realize, oh man, we need to get you another inhaler, or else you're not going to be able to sleep and breathe. It's a pretty big issue. And so then we're like, man, well, we need to get a prescription for it. And so he started like Googling hospitals in the area in Switzerland that we were at, and he found a couple. We didn't really know anything about them. He called them, they didn't answer. He emailed, we didn't get an answer. And he's having trouble breathing. So we're like, what do we do? We'll look at a telemedicine. And so then we start Googling telemedicine platforms, and we find that we can get an online consultation in Switzerland for 400 Swiss francs, which is like 450 US dollars or something like that, just for an online consult. And I was like, oh my God, okay, no, we're not doing this. And so then it's like, okay, let's just see if this works. Like just opt in on an online consultation with one of our doctors on Docosan, have them write the prescription for the inhaler, that you need. You can do this, and then we'll take it to the pharmacy and see if it works. And it did work. So we were able to get like his asthma meds for $6 through the online consultation on Docosan with a good Vietnamese doctor, as opposed to 400 Swiss francs. And so that to me is another kind of like healthcare access issue. Like it's hard to find the right hospital. Are they open? Can you just walk in? We have no idea how the Swiss health system works. So, we were there for like a week. And then two, like the price was insane. And so, yeah, I think like no matter what country you're in, there's always room for improvements. And with a, yeah, convenient, transparent kind of system like Docosan, the sky is really the limit.
That's a very interesting story for several reasons. One is that basically you were able to use the prescription from Vietnam in Switzerland. So, how did the pharmacy react? I mean, in Europe, there's a lot of discussions at the moment and work on the European health data space that's basically supposed to enable that, so that you pick up a prescription in the country that's not your residential place, but that's, a whole discussion and just effort in itself. And Switzerland, for example, isn't even a part of the EU. So I'm like all ears about how, like, what did the pharmacy say when you brought in a prescription that wasn't written by a Swiss doctor?
Yeah, I mean, so it was a picture of the prescription that the doctor had handwritten here in Vietnam. It was in Vietnamese language, but it did clearly say the medicine and the dosage and how to take it. And so he brought it to the pharmacist, and she filled the prescription. Maybe if it had been for like some very like heavily scheduled kind of substance, like like a opioid or something, she wouldn't have gone for it. But this guy was clearly like having some asthma issues when he went and gave the picture of the prescription to her, and so she filled it. And so I don't know. I'm not familiar with like the Swiss healthcare system and the regulations or anything there. We were just there for a really short period of time, but I think it was just kindness and of that pharmacist and seeing this patient had a need to get his medicines filled right away. But I mean, yeah. So I don't know if it could work everywhere, but why not though, right?
Mm. Yeah, yeah, yeah. From the patient perspective, this is something that we would hope that would be possible everywhere. Given that you came from the US to the region, what are some of your experiences with the healthcare system here, and how do you compare them with the experiences that you had in the US?
Yeah. So I guess like in the U.S. So I'm originally from Albuquerque, New Mexico. There's a doctor shortage there. Like most of the care is kind of like like the one of the biggest employers in the state is like the university and the university health system. But for my own kind of experiences, um, I guess I didn't like I was young. I didn't really have too many. I remember I was trying to get an IUD once from just kind of like my general practitioner, and they said I couldn't get it because I didn't have a kid already, and I could only get an IUD if I had had a child. And I was like, oh man, this sucks. And then I remember like when I joined the Peace Corps, I tried to get one again, and they were also like, no, it's too dangerous. We can't give you an IUD. But IUD is one of the most like effective and like convenient kind of birth control for women to get. And so there was this strange kind of like, I don't know, misunderstanding or stigma about having a kind of like younger unmarried woman who was like trying to get an IUD. And so that I guess like is one thing that comes to mind versus in Southeast Asia. I mean, I've never had any sort of like problem accessing like the reproductive health care that I've needed. Um, so yeah, I guess like that would be one kind of difference. If you want to talk about the healthcare system as a whole, though, like it's got different incentives. So the U.S. market is driven by insurers as payers, and the whole healthcare system is pretty optimized around these private insurers. And so it's not optimized around patients, which is why a lot of people have issues with it. They're not the person paying for the care, so like who cares if it's convenient or if if it's such a pain that you have to find a doctor in network who takes your insurance, and maybe they're available in this state, maybe they're not, maybe you can't get an appointment with a doctor within who's in your network within a certain period of time. I mean, there's certainly like lots of issues in healthcare in the US, and I'm really heartened to see some great startups who are taking that on. And a lot of startups who are bringing preventive care and monitoring into the homes of patients. So there are really cool startups like Levels who are promoting like home like blood testing and health monitoring. Whoop, Noom for kind of like behavioral change in weight loss, or inspiring companies. Everlywell, which brought home testing to patients. And so people kind of see that it is a healthcare system that is broken, but as an entrepreneur, when you see something that is broken that people really need, there's an opportunity there to fix it. And I think healthcare is so cool because not only do you have the potential to solve a big problem that impacts potentially literally everyone needs healthcare at some point in their lives, have this strong social impact, but you can also have a very strong and good business behind it as well.
Mhm. Speaking of entrepreneurship, as an expat in Vietnam, how was it for you to start the business? You know, given the different culture, how did the environment, what was the attitude of the environment towards you as a founder? Did you have any trust issues? What kind of culture challenges did you encounter when building a business? And even now, when we spoke first, you mentioned that people are still asking you, when are you going back home? Because, you're originally from the
Yeah.
US.
Yeah, I mean that's like a kind of like common thing that I've experienced throughout Southeast Asia. Even though I've been here over like 10 years, people are like, "Oh, when do you go home?" I'm like, "I am home. I'm I guess it's I've got property here and everything. I don't see myself going anywhere else." But as far as kind of starting the company, I think Vietnam is an awesome place to start a company in certain ways. One is there's a highly educated talent base. So there's awesome software engineers that you can hire. So Vietnam for a long time has been a bit of a hub for outsourcing. A lot of like European and US and global companies would get their websites and apps and everything built here. And so that was already like part of the job structure and training. And so then if you want to start a product company like Docosan, you find these kind of engineers who are used to the outsourcing kind of like way of doing things, introduce a product mindset, and there's a lot you can do. So I think like the talent base for engineers is a super strong point. But then as far as yeah, kind of like starting the business, like understanding the local needs and all of that. When we first started, I guess it was challenging to navigate. Like, okay, so how do we get the right company set up? There's a lot of like rules and laws, and of course, like you have to get licenses too. Here, especially like in healthcare. And so the way that we're able to do this is just, people. You have to meet the right people. And so the right people we met was a really good law firm who was able to help us kind of like navigate through, those trenches to be able to start like this new type of company in a fully compliant manner. We still work with this law firm. um, then, in terms of healthcare, I think it's actually kind of interesting in Vietnam. And I've seen this in a lot of other countries in Southeast Asia too, where they actually trust foreign brands more than the local brands. There's been scandals in the past with kind of like, quality of medicines issues, of like supplement quality, stuff like that. Every once in a while, you see things like this in the news. But foreign companies, they might follow standards that are set in like Europe or the US and have a brand to protect, and so people actually do tend to protect to trust foreign brands in healthcare even more than local ones. So I think that is a little bit of an advantage in being someone from somewhere else coming in and starting a company. I also think like it just brings a different perspective, right? Like, so I certainly like you have to have awesome business partners in whatever country that you live in, because you have to localize the platform. You have to learn the way that sales and marketing works in each of these countries. But yeah, I think like but if you look at the US, like there's a huge proportion of businesses are started by immigrants. A lot of times they come from their countries and have different perspectives, and come to the US and see all these kind of like new opportunities and problems to solve in a different way than maybe someone who'd grown up there and had that as a status quo wouldn't have had. And I see it the same way as me coming here too, right? Like I see I have like a different perspective having grown up somewhere else, experienced a different, different health systems and all of this. But I also see tremendous opportunity in Vietnam, like, kind of the rest of Southeast Asia. And I not only opportunity to build a great business that, you know, is financially successful and grows and gets good returns for investors, but also something that helps people, that helps them get care in a new way. And I think like given the state of development in Southeast Asia, there's an opportunity for outsized returns, both in terms of finances as well as social impact.
Where do you see that you are facing the biggest challenges in terms of the development of your business? We mentioned earlier that you are basically just a platform for healthcare providers. You don't employ doctors, which helps you to avoid any liability in terms of clinical issues that may arise. So, what do you see as the biggest challenges that you are facing as a business?
Yeah, so I guess like we're coming into a period of time in which like growth and strong bottom lines are really important. So a lot of factors in the macro environment have changed, whereas like before in say 2020, 2021, a lot of venture capitalists were just looking for, okay, just grow, get a ton of users, revenue will come later. That's no longer the attitude anymore. And so now everything is about like not only like, okay, so what is your monthly recurring revenue, but like what are your unit economics behind them? And so what we're really focusing on is developing additional types of like products that have strong unit economics and growing in a sustainable way. And so yeah, I think like that's the biggest kind of like challenge that we're working on now. But there's a lot of ways of doing that, and a lot of advantages too, because we already have this whole network of third party providers who are using the software, paying for it. And then we have our home diagnostic kind of like test kits that have good, healthy margins and deliver care in a new way. And so it's just figuring out what is the fastest yet most sustainable way to grow those two verticals.
Since you mentioned investors, can you share any of the experiences that you had on that front? So, how did you approach looking for investment? In which countries did you look at investors? Um, and what was the most difficult part there? And I think it's also always interesting to hear from startup founders to about how many investors that they spoke with before finding the first supporter. I guess it's it's encouraging for others to hear that you will hear no a lot of times before you get to a yes.
Yeah, for sure. I mean, as a founder, you'll get rejected, probably thousands of times and during the course of your company. So as far as investment, we did our last like public round in 2021, which was led by a Taiwanese VC called AppWorks. And they led the round after we participated in their accelerator. And they're a really interesting VC because they're active not only in Taiwan, but across Southeast Asia. And they're really into AI, Web3, but they're also trying to expand in more of the countries in the region. And they've even become LPs and some local kind of venture capital firms. And so they have like a pretty long kind of like vision and timeline for themselves. And we got to learn a lot about like yeah, it's just kind of like the thoughts of VCs from them. And it's we've been lucky that we've had good investors with us from the beginning. Since then, we've raised additional capital. I guess like we will announce like we'll announce it like the next time when we have like a price round. But most of the investors are in different countries in Asia and then in Silicon Valley. So yeah, it's been really great having like experienced investors that have been on our side, because then they can give good advice, kind of like guidance, and they also understand that startups are up and down. It's not all like grow super fast and everything will be great all of the time.
Mm.
And yeah, a good investor will help you get through that.
Do you have any additional advice for anyone that would want to work in the region in terms of, how to kick off the the business? Because one thing that I did think of in terms of the difference between the local investors to the Silicon Valley investors, I imagined that someone that's local would have a much better understanding of the environment that you operate in, the challenges that you are facing, and maybe even connections that could actually help you compared to somebody that's abroad. but maybe that's just my wrong assumption. So feel free to correct me if I'm wrong.
I mean, both can be useful too. It just depends on like what you're looking for, what stage of the business you're in. So I think like we have benefited a lot from having international investors. We've got a very strong local team on the ground who are here operating. We've got a very strong local network of partners and clients and other people who are not just investors who are helping us to guide us and to grow. And so I wouldn't look at like investors as kind of like, the main mentors and the people kind of like, your guiding light at all. It really should be your customers. And if you're constantly paying attention to your customers, you've got a good team who are also like really paying attention to the customers. Like the investors will be happy anyway because you're focused on building a good business. And then I guess like in terms of advice of people looking to come to Southeast Asia, I think do it, try it. I am really inspired when people from other countries come and try to do something new and bring different insights. I have a friend who recently moved to Ho Chi Minh City from well, he was in Seoul. So he's Korean. He did grad school at the Harvard Kennedy School, and now he's got this kind of like sustainable energy startup called Refeed. And I think it's so cool what he's doing because they have these like amazing engineering skills, and they also see all the opportunities to kind of like transform the energy sector here. And they're coming in, bringing that new perspective and doing it. And it's when you come in, you have to be, of course, like very respectful that you didn't grow up here. You don't know everything that's going on here. There's a lot of stuff that is hard to understand. So you need really good partners that will help you guide you through it. And so when you first come to the market, get set up correctly, get those like good kind of like lawyers, make sure everything is compliant, and then next comes finding the right kind of business partners who you can trust and who will work with you. I have the advantage of having been in Southeast Asia for a long time, so I have a good personal network. I have a lot of friends that have grown up here and been here a long time and stuff too. So that was less of a challenge. But I'm really inspired when people, yeah, try something new. And I think like you shouldn't be discouraged from wanting to go, and as long as you have like good expertise and are trying to create value and doing it in a legal way, like why wouldn't they welcome you?
I was